Everyone's telling you AI is coming for data jobs. Headlines, LinkedIn influencers, your uncle at Christmas. So, is it true? Should you even bother trying to break into healthcare data analytics right now? Short answer, the job is changing. But if you're worried AI is going to replace you before you even get started, stick around because the real story is more interesting and, honestly, better news than you think.
Section 1. What AI is actually automating right now? The grunt work is going first. Let's be honest about what AI tools are good at right now. Writing a structured query language from a plain English prompt, cleaning a messy spreadsheet, building a first draft dashboard, summarizing a report. These are real capabilities, and they're getting better fast. If your entire value as an analyst was, I know how to write a VLOOKUP, or I can build a bar chart in Power BI, that part of the job is being compressed. AI can do a rough version of that in seconds. But compression isn't replacement. Here's the distinction that gets lost in the panic headlines. AI is automating tasks, not judgment. It can generate a query. It can't tell you which question is worth asking in the first place. It can build a dashboard. It can't tell you why a spike in complaint rates for one product lot actually matters, or what regulation requires you to act on it. Section 2. The data behind the fear. What analysts are actually saying. This isn't just optimism. It shows up in how working analysts describe their own jobs. Most report that AI automation is making them more effective at their work, not obsolete. And a majority say they feel more strategically valuable now than before AI tools showed up, because someone still has to translate the output into a decision a business or a hospital or a regulator actually acts on. The job title data analyst isn't disappearing, it's shifting. From someone who mechanically pulls and formats data to someone who interprets it and explains what it means. Where the real bottleneck is. Hiring managers aren't struggling to find people who can code a query anymore. AI has lowered that bar for everyone. What they're struggling to find is people who can explain the result, connect it to a real business or clinical outcome, and be trusted to make the right call with it. That skill is not something a language model can hand you. It comes from actually understanding the domain you're working in. Section 3. Why this is especially true in healthcare. Healthcare data isn't generic data. This is where healthcare specifically becomes a huge advantage for you. This isn't retail data or marketing data. It's regulated. It touches patient safety. There are legal obligations, like post-market surveillance requirements under EU MDR, around how you're supposed to monitor, trend, and escalate signals in the data. An AI model doesn't know that a rising complaint rate for one product lot might trigger a regulatory reporting obligation. It doesn't know the difference between noise in the data and an adverse event signal that needs escalating today. That context, the why it matters, is exactly what a domain-literate human brings. And it's exactly what's hardest to automate. Domain expertise multiplies your value. This is backed up by how the market is actually paying people. Analysts who combine technical skills with deep expertise in one specific industry, healthcare, finance, whatever it is, are consistently valued far more than people who only know the tools without the context. In a world where anyone can ask an AI to write a query, the person who understands what the query should be answering is the one who's hard to replace. Section 4. What this means for you, practically. Stop trying to be a generalist. So here's the practical takeaway if you're trying to break into this field in 2026. Don't try to compete on, I know Power BI or I know structured query language alone. Everyone will know that soon. Partly because AI will teach it to them in an afternoon. Compete on depth in a niche. Pick something specific, complaint trending and post-market surveillance, clinical trial data, population health, insurance claims, and go deep enough that you understand not just the data, but the regulations, the stakes, and the decisions that data feeds into. Prove it. Don't just say it. And don't just put healthcare domain knowledge on your CV as a bullet point. Show it. Build a project that demonstrates you understand both the analytics and the context. That combination, technical skill plus real domain fluency, is exactly what's going to set you apart.
And it's exactly what I'll be walking through in the next video, where I build a complaint trending dashboard from scratch and show you how it maps to real regulatory obligations. AI isn't going to hand you this career, but it's also not going to take it from you if you focus on the part of the job that actually requires a human understanding the domain, not just the tool. If you want a head start, I've got a free roadmap PDF linked below that walks through exactly how to build that domain expertise, project by project. Subscribe if you're serious about breaking in, and I'll see you in the next one.